Hi everyone, I'm Mia Salans, and I'm working in the Department of Radiation Medicine and Applied Sciences with Dr. Hadengati Gluth, and my project is on fine motor coordination after brain radiation. So primary brain cancer is treated with a combination of chemotherapy, radiation, and surgery. And radiation in particular has been associated with cognitive decline that can be progressive and irreversible. There's been a lot of focus on the specific cognitive domains that are most heavily impacted by radiation, and studies have found that memory, language, executive function, and attention and processing speed are all affected by radiation, but there's been less focus on fine motor coordination. Fine motor coordination is a skill that's involved in a lot of everyday tasks. It's involved in things like handwriting, typing, using silverware, and playing a musical instrument. So as you can imagine, a decline in fine motor coordination could have pretty significant consequences for quality of life. So previous studies have actually identified imaging biomarkers that we can use to predict function in all of these cognitive domains after radiation, but none have yet been identified for fine motor coordination. It would be pretty useful to have some biomarkers of fine motor coordination for a couple of reasons. For one, if we could identify structures that lead to worse motor coordination when damaged, we could potentially avoid those structures when planning radiation. But also, if we could identify individuals at increased risk of fine motor coordination decline, we could preemptively target interventions towards those individuals to prevent further decline. So that leads me to the goal of this project, which was to identify imaging biomarkers of fine motor coordination after brain radiation. So we actually already have some biomarkers of injury in the brain. In the white matter, we can look at volume, which declines with injury. We can look at fractional anisotropy, or FA, which is a diffusion tensor imaging metric that basically represents white matter integrity, and that declines with injury. And then we can look at mean diffusivity, which is also a diffusion tensor imaging metric that basically represents edema, and that increases with injury. And then in the cortex, we can look at thickness, and that declines with injury. So this figure here just shows how after radiation we see an increase in MD or edema and a decrease in FA or white matter integrity within white matter structures over time, and that the extent of this increase or decrease is dependent on radiation dose, which you can see here up at the top. So with those biomarkers in mind, our hypothesis was that decreased fine motor coordination would be associated with decreased volume, decreased FA or integrity, and increased MD or edema within white matter structures, as well as decreased thickness in cortical structures. And we were specifically looking at these biomarkers within regions of the brain that subserve motor function, which I'll go into in a little bit more detail later. So here's our study design. We enrolled 57 patients with primary brain tumors that were set to undergo partial brain fractionated radiation. And all patients underwent MRI and diffusion tensor imaging, as well as an assessment of their fine motor coordination at baseline, and then 3 months, 6 months, and 12 months after radiation. We used an auto-segmentation software to identify motor regions of interest, and then we looked at the biomarkers that I discussed earlier within those regions. So here we specifically looked at thickness of the precentral, postcentral, and paracentral cortex, all of which are involved in motor function or somatosensory function. We also looked at the superficial white matter just beneath those cortical areas, and here we define the superficial white matter as any white matter that's up to 5 millimeters below those cortical areas that I mentioned earlier. And then we looked at the volume, FA, and MD of the corticospinal tract, which for those of you who don't know, it's a long white matter tract that transmits signals from the primary motor cortex all the way down to the spinal cord, and that's shown in purple here. And because it's such a long structure, we actually broke it down into its anatomic subparts. So we looked at the corona radiata, which is further up here, the posterior limb of the internal capsule, the cerebral peduncle, and then the basis pontis. We also looked at the cerebellum. So specifically, we looked at the volume of the cerebellar cortex, which is shown in purple here, as well as the volume, FA, and MD of the cerebellar white matter, which is shown in yellow here. Oops. And then last, we looked at the volume of the caudate, putamen, and globus pallidus, all of which are basal ganglia structures that are involved in motor coordination. So we measured fine motor coordination using 2 different tests that are well validated and have been used in cancer and non-cancer patients. This first test is called the DKEF's motor speed test, and on this test, patients are asked to connect a series of hollow circles according to this dashed line as fast as they can, and the time that it takes them to complete that is measured. So their score is basically the number of seconds that it took them to complete that task. And then the other test that we used was this grooved pegboard test, where patients are asked to insert a series of pegs with different shapes into the correct slots, and the time that's taken for them to complete that is also measured, and patients will complete that with their dominant hand and their non-dominant hand. So it's a little bit counterintuitive, but on both of these tests, a worse or a higher score is indicative of worse motor coordination, and that'll come up later. So here are our patient characteristics. As you can see, we have a pretty wide range of ages represented in our sample. However, our cohort is mostly male, white, and highly educated. We do have a pretty wide range of tumor diagnoses in our cohort as well, but as you would expect, most patients do have gliomas, which are tumors of the cells that support the neurons in the brain. And then you can see that about a little bit over half of patients got chemotherapy along with their radiation, or they got surgery prior to radiation, and about half of patients had a history of seizures or were taking anti-epileptic drugs during the study period. So we had three main questions that we wanted to answer with this project. Our first one was just trying to understand how fine motor coordination changes in this cohort over time. We also wanted to understand whether higher radiation doses were associated with more injury that we can see on imaging to those motor structures. And then lastly, we wanted to understand what these injury biomarkers tell us about fine motor coordination. So basically, are these biomarkers useful for predicting fine motor coordination in this patient population? So for the first question, we use something called a reliable change index to calculate change over time. A problem with these neurocognitive tests is that patients will complete them at multiple time points, so there's always the chance that they'll improve just by virtue of being more familiar with the test because they've taken it a couple times. So the reliable change index basically takes into account that practice effect and gives you meaningful change over time. And then we used a one-sample t-test to determine whether there was significant improvement over time or significant decline over time. And then for these next two questions, we use linear mixed effects analysis to examine the associations between these variables. So our first question was, how does fine motor coordination change with time? So what I've shown here are the mean group reliable change indices between 0 and 6 months on each of these three tests. And what you can basically see here is that there's really no significant change in fine motor coordination for the group between 0 and 6 months. But we did want to understand whether there were specific subgroups within our cohort that experienced more decline than others. So we looked at whether characteristics like sex, age, whether they got chemotherapy, things like that, had any impact on the level of fine motor decline. And we did find that there were a couple characteristics that were predictive of worse motor coordination after radiation. For one, as you would expect, older patients did experience more fine motor coordination decline than younger patients did, and that's sort of shown on this graph on the right. I don't know where the mouse is. But anyways, what you can see is that patients experience less and less improvement in their motor coordination up till around age 55, and then at that point they actually begin to decline in their motor coordination. We also found that non-white patients experience significant decline in their motor coordination compared to white patients, but we do think this is a sample size issue since only 7 non-white patients completed testing at 0 and 6 months, but that is something that we'd like to look into more in the future. And then lastly, anti-epileptic drug use was associated with improvement in fine motor coordination, which is a little bit surprising because a lot of the literature notes an association between anti-epileptic drugs and neurocognitive dysfunction. So we're not 100% sure what's going on here, but one hypothesis is that patients with seizures are put on anti-epileptic drugs kind of at the beginning of the study, right around the time of their surgery, and what we're seeing here is stabilization or improvement of their motor coordination because their seizures are being controlled. But again, that's something we'd like to look into more in future studies. So our second question was, do higher radiation doses lead to more injury in motor structures in the brain? So if you remember, MD is a marker of white matter edema, and that increases with injury. So you would expect to see that as dose increases, MD should increase as well. And we do see that here, that as dose to the right precentral white matter increases, the level of edema in that structure also increases. With cortical thickness, we expect that to decline with injury, so you would expect that as dose increases, cortical thickness should decline. And we do see that here again, that as dose to the right paracentral cortex increases, the thickness of that structure declines. Our last question was, what do these biomarkers tell us about fine motor coordination? So volume we expect to decline with injury. So we expect that as volume goes down, motor score should increase, because if you remember from my previous slides, a higher motor score is actually indicative of worse motor coordination. So we do see that here, that as the volume of the left and the right cerebellar cortex declines, patients have worse performance on the pegboard dominant and pegboard non-dominant hand tests. FA is a marker of white matter integrity, which declines with injury. So we would expect that as FA declines, motor score should go up. And we do see that here, that as the integrity of the right precentral white matter declines, performance on this DKEF's motor speed test also declines. MD is a marker of edema, and that increases with injury. So we would expect that as MD increases, score on the motor test should also increase. That should be a positive association. And we do see that here, that as edema in the left and the right cerebellar white matter increases, performance on this DKEF's motor speed test declines. And similarly for the left corona radiata, as edema in that structure increases, the performance on the pegboard non-dominant test declines. And then lastly, cortical thickness declines with injury. So we would expect that as thickness declines, motor score should go up. And we do again see that here, that as thickness of the left and the right precentral cortex declines, performance on the DKEF's motor speed and pegboard dominant hand tests also declines. So to summarize, our first question was how does fine motor coordination change with time? And we found that patients who were older and also patients not taking anti-epileptic drugs experienced more decline in their fine motor coordination between 0 and 6 months. But these are associations that we'd like to look into more in the future. We also wanted to understand whether higher radiation doses were associated with more injury to motor structures in the brain. And we did find that higher doses, specifically to the superficial white matter and the motor cortex, were associated with more injury to those structures. And then lastly, we wanted to understand whether these biomarkers were useful for predicting fine motor coordination. And we did find that in multiple motor structures throughout the brain, these biomarkers were associated with fine motor coordination. So these might represent structures that we might want to avoid when planning radiation in order to preserve fine motor coordination, particularly in patients that are at an increased risk of motor decline, like older patients or maybe patients not taking anti-epileptic drugs. Recently a study came out that looked at hippocampal sparing radiation to preserve memory and found that patients who did not receive radiation to their hippocampus had better memory scores compared to patients who did. So maybe a similar type of study could be done in this situation where critical motor structures are avoided in order to preserve fine motor coordination. That's it.
About the cerebellar volume one, why are they exactly the same for the left and the right? Which is that really? Is that?
Yeah, I ran it a couple times and I checked the data, and that's what I kept getting. Yeah, I'm not sure. It was kind of weird to me too.
Right.
I have a question about the content validity of the anatomic structures you're looking at. I certainly the motor conduction and coordination through the cerebellum makes a lot of sense, but do these tests also depend on visual issues or sensory input from the hands and so on?
That's a good point. Yeah, definitely for the motor dexterity, I think depends on somatosensory function as well, and we sort of tried to capture that by looking at the somatosensory cortex. But there are definitely more structures that are involved in that, and we just didn't look at them yet, but that could be a future study, definitely.
Do you, it's really intriguing data, do you have information on what happens to these patients in terms of their overall neurological status with respect to post-radiation? Because obviously part of the intent of radiation is to reduce the tumor effects, and so if you present with a certain set of neurological findings, do those coordinate or do they associate with the changes in the fine motor coordination?
You mean
so
like
in
other
words,
types?
you've got patients who have a set of neurological findings.
After radiation?
No, before radiation.
Oh, I see.
And then so some of them are going to improve, some are going to stay the same, some are going to worsen. How do those changes correlate with the changes in the fine motor coordination?
I'm
Maybe
not
you
sure,
always
yeah.
come up with a study, but
I'm,
it's
yeah,
in
I'm not
general.
sure. I mean, I know, yeah, I don't know if I have an answer for that. I know like radiation is associated with neurocognitive decline. Like I mentioned, patients at around 6 months, they start to develop these neurocognitive deficits, and often they are kind of irreversible, but I'm not sure how it would correlate with like pre-existing neurocognitive dysfunction. But yeah, it's an interesting question.
So of all these structures, if you had to rank them, what was the most important predictor then of the motor or fine motor?
I think the cerebellum, actually, there were a lot of structures within the cerebellum that were associated with fine motor coordination, which is kind of interesting because the cerebellum is sort of ignored. When planning radiation, there aren't really any dose constraints to the cerebellum, so I think this study kind of shows that like maybe we should start paying attention to the cerebellum. And I also thought it was interesting that like both sides of the cerebellum were associated with function in both hands, which is kind of interesting. And there are studies that show that like both sides of the cerebellum kind of light up when you're using your non-dominant hand. So yeah, I think kind of future studies might you know, further clarify that relationship. Yeah.
Thank you.
Thank you.